Let's learn about the extraocular muscle and its function. To answer the extraocular muscle and its function, we have to remember certain rules. And the first rule is that the rectus muscle gives the direct meaning. That is, when the rectus muscle is combined with either superior or inferior, they give the direct meaning or obeys in the same direction. That is, when superior rectus, superior means elevation, which helps in the elevation of eyeball. Whereas inferior rectus, inferior is depression, which helps in the depression of eyeball. But the oblique muscle is combined, it gives an opposite direction or it gives an opposite meaning. That is inferior oblique. Inferior means depression, but the muscle inferior oblique helps in the elevation of eyeball. The same applies here. The muscle superior oblique helps in the depression of eyeball. That is, from the rule number 1, we come to know that the muscle superior rectus and inferior oblique help in the elevation of eyeball, whereas inferior rectus and superior oblique muscle helps in the depression of eyeball. This is for rule number 1. Next, moving on to the rule number 2. The rule number 2 is that all the superior muscle helps in the intorsion. That is superior rectus or superior oblique, which helps in the intorsion of the eyeball, and all inferior muscle, inferior rectus or inferior oblique, which helps in the extorsion of the eyeball. This also can be remembered with the mnemonic. We have to exit our sin. Here exit EX stands for the extortion, and it is due to the inferior group of muscles and superior group of muscle which helps in the intorsion of eyeball. This is rule number 2. And the rule number 3 is that all rectus muscle helps in the adduction, and whereas oblique muscles helps in the abduction. This also can be remembered. Here the word oblique, the second letter is B, and in the word abduction, the second letter is B. So rectus muscle helps in adduction, oblique muscle helps in abduction. These are the 3 rules to be known in the functions of extraocular muscle. Let's apply it. If we have to see on the left side, if we have to see on any side, the same side lateral rectus muscle is used. For example, if we want to see on the left side lateral rectus is used, and opposite side medial rectus is used. Meanwhile, we answer the same type of question. If we have to see on the right side lateral rectus muscle is used along with the left side medial rectus.